Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic is an overview of RSD and CRPS. Well, what are they? RSD stands for Reflex Sympathetic Dystrophy, CRPS, Complex Regional Pain Syndrome. Both represent chronic pain neurologic syndromes that are very frustrating to both patients and doctors. The basic problem is an overactivity of the sympathetic nervous system resulting from trauma, surgery, and some unknown causes. In the early 90s, the International Association for the Study of Pain changed the name from RSD to CRPS to try and characterize the condition better. However, both of those terms are still widely used in the public's repertoire. The total numbers are unclear of how common it is, but somewhere between 5 and 12 million Americans suffer from the condition. 3/4 of those afflicted are female, and it's unclear why it occurs. We know it involves an overactivity of the autonomic nervous system, specifically the sympathetic part of the system, but the trigger sparks it up and it just doesn't shut off. So what are the symptoms? Well, they're going to range. It could be severe burning pain that is intense and much stronger than would be expected for the injury sustained. The pain gets worse over time rather than better. It can start at the point of injury but then spread to the whole leg or arm, and it can even spread to the other side. There can be significant sweating, swelling in the tissues, extreme sensitivity to the affected area, bone and skin changes, and then depression, insomnia, emotional problems. There are 3 stages. The first stage is 1 to 3 months, where you start to see skin temperature changes, muscle spasms, severe burning pain that is worse with even a slight touch. Hair and nail growth is faster than normal, and the beginning of some skin changes, blotchy, pale, shiny, sweaty. Stage 2 is in the 3 to 6 month range. You start to get more skin changes, cracking of the nails, worse pain, hair growth that slows down, and then weakening muscles and stiffening joints because you're not using them because they hurt. The stage 3 is when it becomes irreversible. You get some muscle wasting, entire arm or leg involvement, and then limb contractions. Treatment options, first and foremost, it's a hard to cure condition, but it can be slowed and reversed significantly with such things as physical therapy, medication options, which may include narcotics, antidepressants, blood pressure medications, anti-inflammatories, steroids, neuropathic medications such as Lyrica, Neurontin, and then calcitonin. Lumbar sympathetic or stellate ganglion nerve blocks can be very helpful. You see one of those here, sympathetic block. If that works and then wears off, then a surgical sympathectomy can be helpful. A spinal cord stimulator is a great last resort, or an intrathecal drug pump. So the treatment outcomes are going to depend on timing. You know, there's a reason that there's so many treatments available is because there's really no one, quote, silver bullet. You really got to try several things, but the earlier the better. So there was a large study years and years ago that showed treatment started within 2 years of onset, you can get an 80% good to excellent results. 2 to 5 years, 70%. And then after 5 years, it's very difficult to get a satisfactory outcome. In 2004, they looked at a study where you had spinal cord stimulator for RSD, and it was extremely long-term favorable outcomes with minor complications. So when you look at lumbar sympathetic block or stellate ganglion block, so when you're having an arm type problem, a stellate ganglion block is the answer. When you're having a lower extremity problem, it's a lumbar sympathetic block. So the anesthetic is injected, and it warms the skin immediately in the affected limb, so that's how you know that it was an effective block. Pain relief may occur within a half hour. It may last for days to weeks. You may need 1 to 2 blocks per week with about 5 total to permanently relieve one's symptoms. And if that works and then wears off, an operative sympathectomy may become necessary. So it's a complicated condition, and there's a lot that we don't know, and there's varied presentations. So a combination of options with individualized treatment is typically best and leads to the most successful outcomes. The goal, remember, is to break this cycle of sympathetic overactivity and to reduce the ongoing pain. Earlier treatment, better. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics throughout the area accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.